All right, we have a brand new development in the treatment of patients with autism. A new study just out found the symptoms of autism could be virtually erased. Right now we're joined by emergency room doctor at Emory and executive vice president of Share Care, Dr. Darria Gillespie. This was a small study. How excited should we be at this point?
Well, Vinny, we do have to remember it was an exceptionally small study, 7 children. And the therapy was started at an age before autism can be reliably diagnosed. That said, in the children that were there, they did see a reduction in their symptoms of autism. And we know from prior research that the earlier intervention, the better. So that we do know that, but it's too early to say anything about erasing the symptoms and curing autism.
Okay, now, and the challenge here, you're getting kids with autism when they're really, really young, but it's difficult at that age to really figure out what's going on, right?
It is, exactly. And they reliably try to diagnose them maybe at 18 months and older, so it's hard to say at this age.
So what happens next?
Next, they need to have a much bigger study and trying earlier intervention and then evaluating how the children are doing in a few years, in 3 to 4 years, and seeing how they're doing before we can draw any conclusions.
All right, let's move on to the next subject, doctor. And everyone's talking about this enterovirus. I don't even know if I'm saying it right. 68?
You got it.
Okay.
Enterovirus or EVD68.
All right, EVD68. I'm going to stick with that.
It's easier.
They say it's like a common cold, but it can be much, much more serious. What are we looking out for here?
Yeah, so enteroviruses are very common. They cause 10 to 15 million people a year in the U.S. to get sick. But they usually are going to get something like a bad cold. Or even something like a rash and a fever, like hand, foot, and mouth disease. Much more rarely do they have something severe, like the severe respiratory illnesses that we're seeing in children right now.
All right, so who has to really be wary of this? Everyone across the board, or certain people more susceptible to the seriousness of this?
There are certain groups that are more susceptible, and those are children with asthma, or severe allergies, or really any child under the age of 5 is at risk, but really children with severe asthma.
All right, so what are we looking for? And then when we see what we're looking for, what do we do?
Okay, so I want parents to watch for symptoms of, it starts out with a cold, runny nose, maybe a cough, and like I said, in the groups that are at higher risk, parents should be exceptionally vigilant. And I want them to look for a few symptoms. Look for trouble breathing, rapid breathing. If you see your child's nose flaring or using these muscles in their neck, those are signs that they're having difficulty. Also, if they just seem lethargic or sleepy, you need to get them in to be seen by somebody quickly.
Okay, and how do you prevent it?
Well, unfortunately, there is no vaccine for EVD68, but it is kind of common sense things. Washing your hands, actually, it can live on surfaces like this table or a doorknob. So if anybody's been, if anybody's been infected and touched that, you can catch it. So make sure, wash hands for 20 seconds. Teach your children about washing their hands, especially before they touch their face or their eyes or mouth.
All right, Dr. Darria, I would shake your hand, but that's probably not a good idea right now, right? Really appreciate all the information. It's great. Thank you so much.